If you're among many who think the swine flu threat was overhyped, Dr. Richard Besser has a message for you.
There will be people who are hospitalized, and unfortunately, I expect that there will be more deaths.
The dire warning issued by the acting head of the Centers for Disease Control and Prevention is the latest in a string of grim predictions issued by officials since the outbreak began. In an interview with the Associated Press, Besser admits the outbreak appears to be less severe than first feared, but he makes no apologies for talking tough about swine flu.
I think that the actions taken in terms of being aggressive, taking those steps that could prevent major impacts on people's health early on and then backing off is really the only way to go.
Some argue much of the hype surrounding the virus didn't come from the CDC, but instead was caused by an overwhelming amount of media coverage.
This story probably got more coverage than it ended up deserving. But I think the tone of the coverage was more restrained than the amount of coverage. There wasn't hysteria in all that time. There just was a lot of time spent.
And Tom Rosenstiel of the Pew Research Center's Project for Excellence in Journalism praises the way health officials communicated with the public.
Even if the questions tended to be, at times, to border on panicky, the answers that we got tended to be cautionary, conservative, and I think sort of in tune with the event.
Problem is, no one yet knows exactly how the swine flu story will end.
The thing that's keeping me up at night right now is that feeling of dodging the bullet, and the sense that people are taking a sigh of relief too soon. We don't know what this virus will do, and we need to make sure that we are ready to go should this virus come back in the fall in a more severe form.
For now, the safest move may be to remain on high alert. Convincing the American public of that may be the real challenge. Jason Bronis, The Associated Press, Atlanta.